Hello, this is Nathan Carlson coming to you from the 24-Hour Flex Studios. And I'd like to talk to you today about eligible medical expenses. First, I'd encourage you to watch the Cafeteria Plan Basics Part 1 and 2 videos, which contain general information on cafeteria plans and medical and daycare rules. Now, the general IRS rule that we have to contend with here is that the amounts that are paid for diagnosis, cure, mitigation, treatment, or prevention of disease, or for the purpose of affecting any structure or function of the body, these amounts are eligible medical expenses. Let's take this one step at a time. Diagnosis. What do we mean here? Well, this would be diagnostic hearing and vision and blood tests, CAT scans, heart scans, MRIs, urine analysis, x-rays. All those are examples of diagnostic procedures that are eligible medical expenses. Cure. Drugs that are used to restore health, such as chemotherapy to treat cancer or prescription antibiotics to treat an infection. That would be an example of a cure. Mitigation means to make something less harsh or severe. A cane or a wheelchair, dentures, prescription glasses or prescription sunglasses. These are examples of items that will mitigate or make less harsh or severe a medical condition. Prevention. This requires that there be a direct relationship between the treatment or drug that is taken and the illness or disease that is being prevented. An example here, a bad example would be vitamins. Generally speaking, there is no causal relationship between vitamins that you take and a specific illness or disease that you are trying to prevent or cure. The expenses must be incurred primarily for the prevention or alleviation of a physical or mental defect or illness. So general divisions here are as follows. You have items that are medical only, which are okay. Then you have personal use items, which are never acceptable. And then dual purpose items sometimes are eligible and sometimes are not. So take these one at a time. Examples of eligible expenses would include co-pays and co-insurance, medical professional fees, doctor office visit charges, dental and vision and hearing expenses, prescription drugs, over-the-counter supplies, and then through December 31st, 2010, over-the-counter medicines and drugs. Ineligible expenses, as I mentioned, include vitamins and toiletries and personal use items, massage therapy unless prescribed for a specific ailment, cosmetic procedure, and then effective January 1st, 2011, over-the-counter medicines and drugs. Now let's take a look at this change in over-the-counter. This change was brought about because of the recent passage of the healthcare reform legislation that was passed back in March, stated that effective January 1st, 2011, over-the-counter medicines and drugs will only be eligible if you have a prescription for that over-the-counter medicine and drug. So what is eligible effective January 1st? Prescribed medicines and drugs continue to be eligible. Over-the-counter medicines and drugs obtained with a prescription. Insulin is always eligible. And then over-the-counter medical supplies. So you need to distinguish between a medicine drug and a medical supply. Let's take a look at an example. Here are some medical supplies that will be eligible effective January 1st, 2011. Contact lens solutions, bandages, ACE wraps, crutches, walkers, wheelchairs, medical devices, hearing aids, denture bonds. These are all eligible medical supplies. Here are some ineligible over-the-counter medicines and drugs. And bear in mind, this is ineligible effective January 1st, 2011. If it's a over-the-counter cough, cold, or flu medication, that's not eligible unless you have a prescription, of course. All of these could be made eligible if you have a prescription for them. Pain relievers such as Tylenol, aspirin, stomach remedies, digestive aids, anti-gas products, acid controllers. These are all ineligible medicines and drugs. Also, allergy and sinus medicine, antibiotics, anti-itch and insect bites, laxatives, sleep aids and sedatives, antifungal creams are all ineligible medicines and drugs, ineligible if you do not have a prescription. When is this effective? It's effective with purchases of over-the-counter medicines and drugs that are made after December 31st, 2010. Note this date applies to all plans and all plan participants. It does not matter if your plans began July 1st, midway through your plan, now over-the-counter medicines and drugs are ineligible effective January 1st. Also, you may be in the IRS grace period, or you may be in your plan's run-out period after the end of the plan year. It doesn't matter. This is a hard date. December 31st, all over-the-counter medicines and drugs become ineligible unless you have a doctor's prescription. So this is a summary of several of the key rules that affect medical flex accounts. I'd encourage you to read your company's summary plan description. I also encourage you, if you want more information on the new changes regarding over-the-counter medicines and drugs, that you look at our video that addresses this one topic. Thank you very much. If you have any further questions, please contact the 24 Hour Flex Help Center.